उपस्थित है। हम सभी का उत्साह उनकी उपस्थिति के कारण बहुत ही बढ़ गया है। विद्यार्थी विज्ञान मंथन विज्ञान भारती का बहुत ही विशेष ऐसा कार्यक्रम है जिसमें अपने देश के नई पीढ़ी को भारतीय विज्ञान के बारे में हम परिचित कराना चाहते हैं और उसी के साथ साथ अपने देश में जो प्रतिभावान छात्र हैं उनका चयन करते हुए उनको विज्ञान के क्षेत्र में कैसे कर सकते हैं इसकी भी चिंता करते हैं। लगभग 8 वर्षों से ये उपक्रम चल रहा है। अपने देश के साथ साथ अपने देश के सारे प्रांत इसमें हिस्सा लेते ही है, परंतु अपने देश के बाहर भी 6 देशों में यह कार्य अब जाकर पहुंचा है और वहां पर भी बहुत अच्छा प्रतिसाद इस कार्यक्रम को विज्ञान भारती को प्राप्त हो रहा है। तो आज सभी का मैं स्वागत करता हूं। इस वर्ष का प्रारंभ आज के इस छोटे से कार्यक्रम से होने वाला है और मैं विश्वास रखता हूं कि इस साल हम इस विद्यार्थी विज्ञान मंथन के कार्यक्रम में एक नई ऊंचाई पर पहुंचेंगे। फिर एक बार सभी का स्वागत, धन्यवाद।
बहुत बहुत धन्यवाद जयंत जी। माननीय मंत्री महोदय जी के लिए मैं 2 बातें कहना चाहूंगा, उसके बाद हम ऑफिशियल रिलीज के चलेंगे। एक तो मुख्य रूप से विद्यार्थी विज्ञान मंथन 2020-21 के लिए इस बार हमने सभी विद्यार्थियों के लिए जो ऑनलाइन एग्जामिनेशन कंडक्ट होगा, जो कि कक्षा 6 से लेकर कक्षा 11वीं तक बच्चों के लिए है, जिसमें जो एग्जाम ऑनलाइन होगा वो ओपन बुक यानी पूर्ण तरीके से अपने घर से वो विद्यार्थी अपना एग्जामिनेशन देंगे और वो लगभग 1 घंटे में 100 अलग अलग सवालों का जवाब देने की कोशिश करेंगे। उसमें मुख्य रूप से लगभग 20% जो सवाल होंगे वो भारतीय वैज्ञानिकों का विज्ञान के क्षेत्र में योगदान क्या रहा है उसके बारे में होगा और इस बार के हमारे वैज्ञानिक होंगे वेंकटेश बापूजी केतकर, जिन्होंने खगोल विज्ञान में अपना बहुत बड़ा जो सहयोग दिया है मुख्य रूप से काल गणना के ऊपर, वो उनका चरित्र इस बार विद्यार्थी पढ़ेंगे और साथ ही साथ में भारतीय खगोल विज्ञान के बारे में भी उनको जानकारी मिलेगी। साथ ही साथ में मंत्री जी शायद खुश भी होंगे, इस बार एक हम राष्ट्रीय रूप में एक प्रयोग करने जा रहे हैं जिसमें जितने भी विद्यार्थी इस विद्यार्थी विज्ञान मंथन में पंजीकृत करेंगे वो विद्यार्थी एक विज्ञान का प्रयोग करने जा रहे हैं जो कि हमारे हेल्थ से रिलेटेड होगा। हम सभी विद्यार्थियों को लगभग 5 दिन के लिए वो क्या अपना नाश्ता करते हैं या क्या भोजन करते हैं उसकी जानकारी लेंगे। उसके कुछ दिन बाद उन्होंने लिए में अपने भोजन में किस प्रकार के कार्बोहाइड्रेट, प्रोटीन, विटामिन लिए हैं उसके बारे में जानकारी देंगे और तीसरे रूप में जब उनकी सभी चीजों की जानकारी उपलब्ध करने के बाद हम उनसे उस कार्यक्रम उस खाने वाली चीजों को लाने के लिए कितना प्रकार का कार्बन फुटप्रिंट का निर्माण हुआ है उसके बारे में जानकारी उनसे साझा करेंगे, ताकि जो हमारे प्रधानमंत्री जी हैं जो हमेशा लोकल फॉर वोकल की बात करते हैं, शायद हम इस प्रयोग के माध्यम से ये बताने में सक्षम होंगे हमारा भोजन हमारे नजदीकी स्वास्थ्य में बनने वाली पदार्थों से ही होना चाहिए। इस बात का हमने एक हाइपोथेसिस लेके चल रहे हैं, वो भी हम इस बार विद्यार्थी विज्ञान मंथन के विद्यार्थियों के लिए होगा। तो सर्वप्रथम मैं मंत्री महोदय जी से अनुरोध करूंगा कि आप सबके पास विद्यार्थी विज्ञान मंथन 2020-21 का ब्रोशर आपके पास पहुंचा है, तो वो हम सब एक बार सबको दिखा के उसका एक अनावरण करने की मैं आप सभी को अनुरोध करूंगा। उसके बाद हम ऑफिशियल वेबसाइट लॉन्च करेंगे। फिर आपका मंत्री जी। बहुत बहुत धन्यवाद। अभी हम ऑफिशियल लॉन्च विद्यार्थी विज्ञान मंथन वेबसाइट का लॉन्चिंग करेंगे, जिसमें विद्यार्थी अभी लॉन्चिंग के बाद पंजीकरण करने के लिए तैयार रहेंगे। तो मैं चाहूंगा कि उस वेबसाइट पे वो एक बटन होगा लॉन्च का, वो जैसे क्लिक करेंगे आज हम वेबसाइट को लॉन्च करने जा रहे हैं जी। शेयर के माध्यम से आपको दिखाया जा रहा है। ये विद्यार्थी विज्ञान मंथन 2020-21 की वेबसाइट है। आज के कार्यक्रम में हमारे जितने भी गणमान्य व्यक्ति हैं, उनके सबके नाम आप देख रहे हैं। हमारे मुख्य आकर्षक डॉक्टर हर्षवर्धन जी के उपस्थिति में प्रोफेसर आशुतोष शर्मा जी, शेखर मांडे जी, जयंत सहस्रबुद्धे जी, विश्वजीत साहा जी, डॉक्टर एन रामचंद्रन, डॉक्टर नकुल पराशर और हमारी पूरी विद्यार्थी विज्ञान मंथन की पूरी टीम इसमें शामिल है। और ये विद्यार्थी विज्ञान मंथन की ऑफिशियल वेबसाइट अभी आप देख सकते हैं और इसके बाद ये पंजीकरण के लिए तैयार है। सभी विद्यार्थी इस वेबसाइट पे आके अपना पंजीकरण दे सकते हैं। मैं इस कार्यक्रम के लिए लॉन्चिंग के लिए मंत्री महोदय जी का धन्यवाद देना चाहूंगा। इस वेबसाइट पे जितनी भी हमारी ऑर्गेनाइजिंग टीम है, जिसके अलग अलग सदस्य काम करते हैं, उसके बारे में, हमारे पाठ्यक्रम के बारे में, सभी के चीज के बारे में जानकारी होगी। मुख्य रूप से भारतीय वैज्ञानिकों का विज्ञान एवं प्रौद्योगिकी क्षेत्र में क्या सहयोग रहा है, उसके बारे में जानकारी आपको मिलेगी। बहुत बहुत धन्यवाद श्री प्रसाद जी। और अभी जिस क्षण की हम अपेक्षा कर रहे थे, उसके लिए मैं हमारे आदरणीय डॉक्टर हर्षवर्धन जी को अपने विचार रखने के लिए मैं आमंत्रित करता हूं, जो कि हमारे पूरे विद्यार्थी विज्ञान मंथन की टीम के लिए प्रोत्साहन वर्धन रहेंगे। हर्षवर्धन जी।
डिपार्टमेंट ऑफ साइंस एंड टेक्नोलॉजी DST के सचिव प्रोफेसर आशुतोष शर्मा जी, CSIR के DG डॉक्टर शेखर मांडे जी, विज्ञान भारती विभाग के राष्ट्रीय संगठन मंत्री जयंत जी, विद्यार्थी विज्ञान मंथन के राष्ट्रीय कन्वीनर डॉक्टर अरविंद रानाडे जी, कार्यक्रम में उपस्थित डॉक्टर रामचंद्रन, विज्ञान प्रसार के डायरेक्टर डॉक्टर नकुल पराशर, श्रीमान विश्वजीत जी, श्री प्रवीण रामदास जी और श्रीमती मयूरी दत्त जी, जो नेशनल को कन्वीनर हैं विद्यार्थी विज्ञान मंथन की। इसके अलावा सभी जो विज्ञान भारती और विज्ञान प्रसार, इसके दूसरे अन्य अधिकारी, डिपार्टमेंट ऑफ साइंस एंड टेक्नोलॉजी के अन्य वैज्ञानिक और साथ में जो बड़ी संख्या में विद्यार्थी जो इस कार्यक्रम के साथ जुड़े हैं, मैं आप सबका हृदय से बहुत बहुत धन्यवाद करता हूं, अभिनंदन करता हूं कि आपने मुझे आज इस शिक्षा के पवित्र कार्यक्रम के साथ जुड़ने का मौका मिला। और ऐसा कार्यक्रम जो मैं समझता हूं कि अपने आप में बहुत ही गौरवशाली है, बहुत ऐतिहासिक है, जिसको सफलतापूर्वक आप कई वर्ष से
its speed and scale across the relevant sectors. The situation today needs innovative responses, and I urge you, Excellencies, to ask your teams to continue to be as innovative as possible. We are building the ship as we sail, and we must be creative in the solutions we find to stay on course, to weather the storm, and to move towards safety. In coming discussions, I look forward to learning more about the successes and the challenges you face in maintaining essential health services throughout the pandemic response. I reiterate WHO's full and ongoing technical and operational support. We are facing a once-in-a-generation challenge and must continue to draw on our collective knowledge and expertise to protect the health and well-being of all people in the region, today, tomorrow, and as long as it takes. I wish you a productive meeting, and once again, thank you very much for your keen support and your engagement. Thank you. Excellencies, we will now turn to Dr. Rodrigo Offren, the WR of India and Acting Regional Emergencies Director, to give us a presentation on a subject which is very often discussed and which is close to your hearts, which is supply chains and logistics. Over to you, Rodrigo.
Thank you, Arki, and good morning, everyone. Good morning, Your Excellencies. May I take the first slide, please? My presentation will be, yes, good morning, now I'm audible. My presentation will be focusing on all the supplies and support that we have provided, what is in the pipeline, and last slide of challenges and possible ways forward. So, as of date, we have been able to mobilize through different sources 482,000 surgical masks, 47,000 of that, 47,000 N95s, 511,000 examination gloves, 36,800 gowns, 10,000 plus goggles, 17,000 face shields, and 1.78 million diagnostic test kits, all distributed as per priority and requests of countries. Next slide, please. Still in the pipeline, I'll keep dividing the goods in terms of PPEs, diagnostic kits, and case management equipment. So for PPEs, we have shipment for 7 countries, including the donations from the Jack Ma Foundation, an upcoming shipment of PPEs and medical masks, as per request of countries, still awaiting also shipment. They are trying to find the appropriate and soonest way of being able to send these goods. Diagnostic kits, a continuous process of shipment of complete diagnostics are undertaken to countries. In terms of case management, this is where the challenge is. The oxygen concentrators are being processed for shipment for 7 countries. That's together with the PPEs with WFP. Pulse oximeters, patient monitors the same way. Ventilators are also in the process of procurement as per requests. And continuous effort is being undertaken to expedite the procurement process for all the other case management items. And just as a point to share is that you may be wondering why WFP is included in this whole process. And maybe in some of the ministerial information sessions that many of you have been regularly attending, this has already been explained. There is a task force across UN agencies, co-chaired by WHO and WFP, to support the movement of these goods and procurement of these goods. and this is controlled centrally in terms of its dispatch and procurement, so that we are able to buy these goods at a lower price. That has been the idea. If too many buyers buy small quantities, then prices of individual goods across these types of equipment and diagnostics become more expensive. So sharing of resources, but centrally controlled, is how this global supply chain process has been conceived. There are still challenges. Next slide, please. Yes, so with that goal that we are able to make sure that supplies get to all countries and all countries have access as needed, there are still issues. The shipment remains difficult in light of limited flights, especially during the lockdown period. Even if they are procured and handed over to WFP, who is in charge of shipment, there is still difficulty in terms of getting permissions for these flights to come in. The central supply chain is less flexible because it's trying to ensure that there is no duplication and oversupply in one country and none in another. But with that, it also takes time. As cases, it goes per order. So if the FE situation evolves very differently in one country, the flexibility of the central supply chain is less to address that. Procurement of expensive supplies also take time, and the care for which this has to be stored and shipped takes time. And so some of these orders that were done sometime May or June have still not arrived, especially for these oxygen equipment. Funding, as of now, as mentioned by RD, this whole pandemic is so much tied to an economic challenge. And so even our regular donors have also invested in their own countries for their own economic packages, but also because the needs for controlling this pandemic has also shifted towards I'll just summarize it in terms of the ACT Accelerator, where you need to develop new diagnostics, new therapeutics, and a vaccine. So there is a shift of all of these resources. Sadly, this equipment that we need to control the pandemic are almost utility for us now. It has to be a regular supply of diagnostics, it has to be a regular supply of PPEs, and eventually a regular supply of all medical equipment for severe cases. The way forward is quite simple, but very difficult to do. Continue to project and prepare the supply chain to ensure an end-to-end delivery. This will also be a challenge for the other essential health services, whether they are regular vaccines for antigens that are for routine and immunization, or essential medicines for NCDs or needs of a primary healthcare center. It has to be coordinated in that flow and not one prioritizing the other, because as mentioned by the regional director, we are already looking at essential health services as an emergency itself. Plan and request well in advance for supplies through the portal. The portal is important because it gives you a picture of where is everyone buying and where is it all going. So the earlier we're able to do that, the better, and continue to advocate for funds, because orders in the central supply chain will not move until there are funds that are ensured. As mentioned by the RDWHO, will continue to advocate for more resources to continue our joint work and your great work in countries to curb this pandemic. At the end of the day, if the epidemics of COVID-19 are solved within countries, then there is more space for other sectors to recover and for the essential health services to continue to be pursued. Thank you very much.
Thank you very much. Rajapur. I would now like to invite Dr. Sunil Behel, Team Leader for Immunizations and Vaccines Development, to make a presentation on the subject Vaccine Development Scenario, which is the other issue which we get the maximum questions from our member states. Over to you, Sunil.
Thank you, RD, and very good morning, Excellencies. I will be giving a brief. So I'll be giving a brief overview of the situation of COVID-19 vaccine development as well as the
Sunil, can you speak louder? We can't hear you very well.
Okay, sorry for that. I will be giving a brief overview of the COVID-19 vaccine development and deployment, where we stand in terms of both these issues. So just to start off with the concept of the access to the COVID-19 tools accelerator, or the ACT accelerator as it is called, which was launched in April 2020 by the Director General of WHO, the President of France, the President of the European Commission, and the Bill and Melinda Gates Foundation, which brings together a range of partners to promote and accelerate the development, production, and equitable distribution of COVID-19 vaccines, diagnostics, and therapeutics. The key partners of this ACT accelerator include WHO, the Bill and Melinda Gates Foundation, the Coalition for Epidemic Preparedness Innovation, or CEPI as it is called, Gavi, UNICEF, Global Fund, and a host of other stakeholders, including the private sector partners. Now, under this ACT accelerator, there are three pillars, one of them being the vaccine pillar. And this vaccine pillar is what I'm going to focus on today. It has three work streams. And these three work streams include, number one, the development and manufacturing work stream, which is led by the Coalition of Epidemic Preparedness Innovations. And it is primarily to support the research and the development and the manufacturing expansion of promising COVID-19 candidate vaccines. The second work stream is the policy and the allocation work stream, which is led by WHO. And this work stream is supporting the development of the global policy recommendations and an allocation framework on the use of the potential COVID-19 vaccines. The third work stream is around the vaccine procurement and delivery, which is looking at the support of the availability of and access of the safe and efficacious vaccine, and this work stream is being led by Gavi. So I'll just spend a minute or two on each of these work streams, and then we'll take it from there. So the first work stream is around the research and development. So as of 31st July, there are 26 candidate vaccines that have moved into the clinical trial phase, and some of these are in the phase 3 clinical trials. In addition, there are 139 candidate vaccines that are in preclinical phase as on 31st July. There are different platforms that are being used to develop these vaccines, and therefore there are going to be different types of vaccines that are being developed. There are vaccines that are beaconed, using the beaconed or inactivated virus vaccines, like the Sinovac and the Sinopharm. There are the viral vector vaccines. An example of that is the Oxford AstraZeneca vaccine. There are nucleic acid vaccines like the Vardhan and the Pfizer vaccine. And there are protein-based vaccines as well that are being developed. Now, these different vaccines, since they are using different platforms, are likely to have different characteristics. And this will mean that there will be variation in the number of doses of these vaccines that have to be given for full immunity. It could be 1 dose, it could be 2 doses, it could even be 3 doses, depending on which kind of vaccine becomes available. It will also have a bearing on the timing of the administration. If there are multiple doses, do we give them at 14-day interval or do we give them at 28-day interval? So those kind of variations will also be there as we go forward in developing these vaccines. There will be variations in the storage conditions. At what temperature are these vaccines supposed to be stored? And these are just some examples, but there are going to be different other characteristic variations as well for the different vaccines as well. So that's on the first work stream. The second work stream, which is being led by WHO, is on the policy and allocation of the vaccines. And this has three components to inform the formulation of the vaccination strategies in the countries. The first is the allocation framework, which sets the frame for the overarching goals and priorities for COVID-19 vaccine. So what is the goal that we're trying to achieve when we give these vaccines? And this is independent of what kind of candidate vaccine becomes available. The second component of the policy and allocation is to look at the strategic advisory group of experts, which provides the guidance and policy advice in the context of specific candidates, for example, on vaccination strategies. And the third component is around the regulatory, safety and monitoring, which provides the guidance on the regulatory issues, the safety and monitoring, both for candidate-specific and system-specific approaches. The final decision, of course, on the policy allocation and the vaccine strategies is going to be made by the countries. Now, this is the allocation framework that is under development, and the goal of the vaccination policy is to protect the public health and to minimize the societal and economic impact by reducing the COVID-19 mortality. So that's the goal. In terms of the priority populations, what is being looked at is that the health and the social care workers are the topmost priority, because if the goal is to reduce the COVID-19 mortality, we go by the risk that individual population groups are facing. The health and the social care workers are at the highest risk, so they become the topmost priority. The second priority is the high-risk adults, and then there are further priority groups. In order to cover the health and social care workers, all countries are expected to receive doses to cover 3% of their population. These are rough estimates that there are about 3% of the total population of a country that is involved, with the health or other social care workers in the front lines. So that's a ballpark estimate. Then when it gets to the high-risk adults, that adds another 17%. So it is expected that when the vaccine becomes available, after the 3% is allocated, the next tranche, goes up to, the countries receive additional doses to cover a total of 20% of their population, and this would include the elderly, the adults with comorbidities, or other risk factors depending on where we are in the country. And then the further priority, once more doses of vaccine are available, it be used to cover more than 20% of the population, which includes the further priority groups within the country. So in terms of the timing of the availability, the first tranche is expected to be received, as it gets received, and these tranches will be in proportion to the total population size of the countries. So the first 3% gets to all the countries to immunize the top risk category and so on. In addition to these, there will also be an expectation of setting up a buffer stock for any emergency deployment based on immediate needs. So that's kind of the allocation framework that is being developed under the WHO's oversight and leadership. Now the third work stream is around the vaccine procurement and delivery, and this is through what we are calling as the COVAX facility. This is a global mechanism to pool the resources and demand for COVID-19 vaccines, and the goals are to accelerate the availability of and the access to safe and efficacious vaccines. The COVAX facility has 4 key objectives. Number one, to manage the largest and most diverse portfolio of vaccine candidates ever. Number two, to accelerate the scale-up of manufacturing. Number three, to equitably make sure that there is an equitable access and fair allocation of the available vaccine. And number four, to deliver the vaccine at scale with intensive support. So with those key objectives in mind, the COVAX facility is looking at categorizing countries into two groups, the fully self-financing countries and the second set of countries that are covered under what is called the COVAX Advanced Market Commitment or AMC, which is a financing mechanism to ensure that the low-income and the lower middle-income economies, as well as the other IDA-eligible economies, also have access to the COVID-19 vaccines. Now, in the Southeast Asia region, Thailand is the country that is falling under the first category, which is the self-financing country, and all the remaining 10 countries are expected to be covered under the COVAX Advanced Market Commitment. Now, the facility aims to make available up to 2 billion doses of the COVID-19 vaccine by the end of 2021. Of these, it is expected that 50% will be financed by the Advanced Market Commitment for low-income and lower-middle-income economies, plus the other IDA-eligible economies. At its core, the facility is a risk-sharing mechanism. So it's trying to reduce the risk for countries that are concerned about failing to secure access to a viable vaccine and reducing the risk for the manufacturers who are concerned about investing without an assured demand. So all the countries are being invited to participate in the facility by making a commitment to get the doses and either contribute in the form of cash or doses. This is especially for the self-financing countries. And then the participating countries receive access to vaccines that are secured by the facility at the negotiated price. The COVAX Advanced Market Commitment consists of manufacturer-specific contingent volume guarantees and market-wide demand guarantee, and the lower income and the lower middle income countries' participation would be supported by the funding. Now, so that's kind of a global scenario, but at the country level, what are the actions that are required for the deployment of the COVID-19 vaccine? So as the development is progressing, countries need to initiate the development of preparedness plans for the deployment of a future COVID-19 vaccine. And these are the things that the countries need to do in terms of the prioritization of the population groups, in terms of the mechanisms, platforms for delivery of the vaccine, the health system requirements, the regulatory pathway requirements, the vaccine safety monitoring mechanisms, the communication strategies, and the monitoring and evaluations. So that's pretty much where we are in terms of the COVID vaccine development and deployment. Thank you very much. Over to you, Madam Ardi.
Thank you, Sunil. Excellencies, I would now like to invite the Honorable Head Ministers in alphabetical order by country to make their interventions, followed by the heads of delegations in similar order. As we begin, let me take this opportunity to wish His Excellency Dr. Terawan Agus Putranto, Minister of Health of Indonesia, as today is his birthday. Good wishes from all of us, Excellency. And as a mark of this special day for him, can I invite him to make the first presentation? Over to you, Excellency, Minister of Health of Indonesia.
Dr. Ponam Ketahapsing, Regional Director of WHO, short as ASEAN Region, Excellency Minister, distinguished delegate, ladies and gentlemen. First of all, on behalf of the government of the Republic of Indonesia, I would like to convey our sincere appreciation to the Secretariat for conducting this meeting. I also appreciated the WHO support in assisting member states to ensure the continuity of essential health services during the COVID-19 pandemic in Indonesia. Ladies and gentlemen, for the past 6 months, the global health system has been put into a test. As governments around the world focus on their COVID-19 response, the magnitude of the impact the pandemic had and still has on essential health services is beginning to unfold. The volume of COVID-19 cases is placing a strain on health systems globally. This trend is especially notable in developing countries that already have limited resources. As a consequence, many other health issues are not getting the same level of attention. Essential health services such as maternal and child health, family planning, communicable and non-communicable disease, and immunization programs are being impacted. When lessons can be drawn from previous health crises, such as the 2014 Ebola outbreak in Africa, COVID-19 has spread on global scale and definitely have a large impact on essential health services. Beyond the direct impact of COVID-19, the pandemic has also triggered a crisis in global health system, severely undermining prospect of achieving the Sustainable Development Goal 3. Therefore, we have stepped up our immediate health response to curb the spread of COVID-19. We must also ensure essential health service continue, keeping progress toward the achievement of universal health coverage and SDGs 3 at the forefront of the global health agenda. In relation to this, I took note of and appreciated the development and designation of the WHO operational guideline of maintaining essential health services in the COVID-19 context, as well as the rapid assessment questionnaire of the continuity of essential health services during the COVID-19 pandemic. However, although these tools are beneficial in assessing member states, including Indonesia, the utilization of these tools needs to be based on a carefully assessed data and information if we want to move toward the right pathway of maximizing the essential health services during the pandemic. For example, the above-mentioned questionnaire show that most of health services experiences partial disruption, such as the maternal and child-related health, TB case detection, malaria control, immunization, and non-communicable disease. The deep and the effect of disruption to the health system in the long run, however, still requires future assessment, especially considering the geographic and population size of Indonesia and assessing the burden of disease. There is no doubt that local specific intervention approach using a world of government and world of society approach are required to maintain the continuity of essential health services in which need to be delivered from evidence. Therefore, the government of Indonesia, in collaboration with WHO Indonesia Country Office, is currently in the process of holding an deep assessment that will be useful to support development of risk mitigation strategies and a potential risk mitigation plan to ensure uninterrupted availability and access to essential medicine and other health supply during our current global situation. that we want to achieve universal health rate and SDGs 3. We will need to future continue strengthening the capacity of health services now and in the future and ensure that national and global health system can withstand not only pandemic but also the fulfillment of essential needs on a continuous basis, no matter the challenges. Thank you very much.
Thank you, Excellency. And may I now invite Mr. Zahid Malik, Honorable Minister of Health and Family Welfare, Government of the People's Republic of Bangladesh, to make his intervention. Over to you, Excellency.
Thank you very much for the honor to speak now. And I also take this opportunity to extend my good wishes and also good afternoon and also Assalamu alaikum to all who are present here and connected to this video conference system. Honorable Dr. Poonam Khetrapal, Honorable Ministers, distinguished delegates, ladies and gentlemen, we all know that the world is facing the greatest threat to public health security. Fighting the COVID-19 pandemic requires a united response, and regional collaborative efforts are also important. We reiterate our commitment to stand together in the spirit of global and regional solidarity to combat this situation. Bangladesh delegate thanks the WHO to organize this virtual meeting of the regional director with the Honorable Ministers of Health on maintaining essential health services in the context of COVID-19. Like other countries in the region, while shifting the health system focus towards the COVID-19 response, the pandemic is disrupting the essential delivery of essential health services in Bangladesh also. There was a drastic reduction in the utilization of major essential health services across all levels of health systems during January to May 2020. However, after May, the utilization rate is gradually increasing. As an immediate response, the Health and Family Welfare Ministry of Bangladesh has developed guidelines on conducting safe immunization, providing essential maternal, newborn and child health services, and nutritional management of hospitalized and ICU patients, and management of essential services for HIV, TB, malaria and leprosy, and all other treatment that is required for the non-COVID patients, such as operation, dialysis, all have been now going on to the best of our ability. Just to share the experiences and challenges that we face in facing COVID-19. Our experience is that we needed more manpower. So we recruited about 4,000 doctors and 10,000 nurses and 3,000 technicians, because to provide services to COVID and non-COVID patients, we need more manpower, and there were also long shifts. So only we had to have 2-3 shifts. So we immediately arranged this manpower. Then the separate isolation center we had to arrange, and that was a very good effort on our part, and which gave lot of space for us to provide health services. We also encourage private health sector, which were initially a little shy in providing services to COVID-19 patients, but they also now engage themselves in the services for the COVID. And awareness building among the population, how to remain safe from the COVID virus. So for that we made extensive media campaign and all sort of campaigns that can be possible. Another very important experience I like to share is that people were encouraged to stay home in isolation and get treatment. And that treatment we could provide through telemedicine. There were about 4,000 to 5,000 doctors, and I must mention the figure that about 90% of the patients got services from home and they got cured. That was a very good experience on our side, and people were convinced, they were rather reluctant to come to the hospital. Only the critical patient came to the hospital. Then mask, social distance, hand wash is the only now situation where everything is opening up. So economic activities open up. So these are the three most important issues, especially the mask, use of mask to contain this COVID-19. Another experience is that early treatment and early detection is the only way to save life, and that has worked quite well in Bangladesh. Initially, we had challenge of manpower, adequate PPE could not be arranged, identified masks were not there, but we had to arrange that. Another problem, and very important, is the supply of oxygen. That is, high flow nasal cannula was not available at that time, nor we knew that it was needed. But once we got those, a lot of lives were saved. And also hospital space for both the patients, COVID and non-patients. COVID, that we made separate arrangements and also arranged new areas for the patients. And another the challenge was that the doctors initially were shy also, and also the treatment protocol was changed quite a few times, and now we have got a good treatment protocol as per the WHO recommendation. These are our experiences, and as I told you that our government also allocated about $1.2 billion for this treatment protocol, and also we got some funding, about $300 million from World Bank, IDA, and other agencies, Asian Development Bank. So all these also are very important for us. The greatest success in building back essential service delivery during COVID-19 in Bangladesh is discovered in the area of immunization. Immunization coverage had dropped by almost 50%, but now after May we have arranged for proper immunization, and now we have got to the required level to some extent. Now you can say that for BCH, Penta 1 and MR is more than, you can say, about 100% coverage has been ensured. Then we have also further challenges that we need still more manpower to put to give proper services. And the non-COVID patients, they suffered also quite a lot because they were also fearing to take proper services treatment because they feared to come to the hospital. So we had to make a separate hospital has to be made for patients. But the patients were in large numbers, so it was difficult for us to arrange that, but we made arrangements. And Bangladesh, just to give you an idea, the present present Bangladesh situation. That is, in Bangladesh, the total death is 3,200, and we have a population of 170 million people, and the death rate is 1.3%. And now average daily death is 35 now at present. Cure rate is 60% plus. Now to some area it is 70-80%. And that is 1,40,000 already cured. Positive case was 2,234,000, out of which 140,000 already cured. So I think this is a impressive number. I feel that the WHO has been supporting us. Regional director, especially Poonam Khetrapal, has been always in contact with us, always through our office, and we got suggestions, and we got the treatment protocol changes that was required, and all the advices which were required for us were given, and we extend our thanks to Poonam Khetrapal and also Director General of WHO. Last and the least issue is the vaccine. On vaccine, elaborate discussion has been made. We now know how it will be available. So, as you know, that we have large population, so our requirement will be quite large. So we are also hoping to get the vaccine in time. So we will be wanting to know when the vaccine will be available, and how this and what are the conditions and the funding arrangement. So these are some of the issues which needs to be known to us or answered. And we are a candidate for the vaccine, the most the earliest one and the potential one which WHO will be recommending, and we are here. So once more, I thank Poonam Khetrapal for giving me the time to discuss and elaborate the position of COVID situation and non-COVID situation, health services in Bangladesh, and also I could ventilate some of our challenges and experiences and shared our experiences with our colleagues here, and also once more keeping our hope for the vaccine as early as possible. I thank everybody, and I thank especially Regional Director Poonam Khetrapal. Thank you very much. Assalamu alaikum, and all the best wishes.
Thank you very much, Excellency, for sharing your experiences in Bangladesh, the various successes which I'm sure everybody is taking note of, and also the challenges that Bangladesh faced. We totally understand your anxiety about vaccines, and we will take all the questions and respond at the end. As far as WHO goes, we are there to support you in every possible way. Can I now invite Her Excellency Yonpo Dejin Bangmo, Honorable Minister of Health, Royal Government of Bhutan, to make her intervention.
Warm greetings everyone from Bhutan. I, on behalf of my king, the Royal Government of Bhutan, wants to extend a very warm and best wishes and prayers to all my colleague health ministers who are today in the forefront of this unprecedented pandemic. We continue to appreciate the support rendered by the regional office under the leadership of Dr. Poonam Khetrapal Singh and our country office here in Bhutan. So we are extremely grateful, and we also feel that it is a timely meeting of all of us to really discuss on this very important agenda, which is really trying to continue essential health services in light of this pandemic. On the onset, I would also like to assure our highest support and solidarity to really work together to not only understanding the pandemic, but also facing this pandemic as well. On the upfront, I would also like to go very briefly over what is happening in Bhutan. As of now, we have 105 cases. And I'm happy to report that almost all the cases are imported cases with a recovery rate of almost 88%. As of now, we have 12 active cases in the hospital, most of whom are asymptomatic cases at this point. Our testing is about 70,000 per million population. Immediate risk for now is a community transmission in Bhutan, and which we are, of course, gearing up for. We have enhanced our surveillance system. We have introduced testing facilities all across the country, and we have recently, literally yesterday, we completed our first serosurveillance study as well, which as of now looks very promising. That gives us a certain level of assurance that there is no community transmission at this point in Bhutan. We continue to have our 21-day facility quarantine and all our positive cases being isolated and managed in the hospital. So, like I said, so far so good. Bhutan being a small country, of course, a lot of things are manageable at this point. For essential services, we do have a plan in place. We have basically done a line listing of all our comorbid patients who are on long-term medications. We have done a line listing of every child that requires immunization. We have done a line listing of all our elderly population. So the strategy going forward in case of a community transmission is really protect these vulnerable population from the pandemic. And in doing so, we have been time and again commanded by His Majesty the King to ensure that the impact of coronavirus, the mortality of the coronavirus is minimized to the highest possible intervention. So with that, I would also like to inform my colleagues here that we have recently completed our HPV vaccination, the first dose for our girls, and this is unprecedented time where we have to do our immunization in case of a lockdown in the circumstances where schools are closed. But my team at the ministry, we have managed to achieve coverage of 95%, which I feel is fairly good given the circumstances. As of now, the immunization rate is around 96%. Essential health services are continuing as normal times. But in case of a community lockdown, we have identified health workers in clusters where they will deliver our essential health services. As of now, the status quo remains where all our health services are continuing, including some of our very, very important essential camps that are happening, given that Bhutan has very limited human resources. These camps play a very important role in providing people-centered care, especially in the rural part of the country. Going forward, I would also like to highlight some of the challenges that we foresee. One, of course, in light of community transmission, is our health human resources. We are a population, we have around 316 doctors at the moment. We have just one ICU trained doctors. After my discussion with Dr. Poonam, we have initiated on training our health doctors on ICU care, and I'm happy to report that we have, as of now, 73 doctors who are trained in ICU care. Then the second one, of course, is again supplies of because of the pandemic, the disruption in the supply and the procurement system globally, where having access to say N95 masks, which are very, very critical for providing safe care to our patient by our health worker, is still a challenge. Access to PPEs is something that I would also like to highlight here. And then finally, very, very excited to hear from Dr. Sunil on the vaccines that are coming up. I think there are few in phase 3 or few completing phase 3. Something that we have been pondering over in the last few months is if the vaccine does come, the affordability for smaller nations, economically challenged nations, accessibility to vaccine, and of course at the end the availability of vaccine. In Bhutan, I'm happy to inform my colleagues here that we have strategized in case if you do get a vaccine, what would be the population that would have a priority. We have developed a guideline and standard operating procedures for carrying out the vaccine. IPI program is one of our best programs among all our primary health care services. So we are hoping that we are going to piggyback on that as well. Understanding the risks of COVID and flu, I think we have in coming months, we will also be vaccinating all our general population for flu as well. So that is very much in the pipeline. But once again, I think these are some of the realities that we are all facing is not knowing what we are dealing with at this point. The uncertainty of when the vaccine will come, the uncertainty on the treatment, and really the geopolitical disruptions. So with that, I once again would like to express my appreciation to all my colleague health ministers across and also the WHO, both the country and the regional office, for providing the technical guidance to the member states. So I thank you for your time. Thank you.
Thank you very much, Excellency. You pointed out something which was also pointed out by the Honorable Minister of Bangladesh, and we are very conscious of that, about the human resource shortages that this pandemic has highlighted. We congratulate you for really having done an HPV vaccine administration to almost 95% of the girls in your country. It is indeed a huge achievement considering the constraints that the pandemic has imposed on such administration of vaccines, and where we have seen in our global survey that most countries around the world, their immunization campaigns have got severely impacted. You raised a very valid point about vaccines, and that is why I thought it was very important to acquaint all of you with the latest in vaccine development and the challenges that would be there. And you rightly highlighted accessibility, which would be a challenge. One is, of course, the development of a vaccine. And then after the development of the vaccine, how would it be accessible to the populations? And you've already done line testing of every child and every elderly person in your country, which is going to go a far way in projecting what your needs would be. WHO, as you know, and as Sunil has highlighted, is working on this framework to see how vaccines would be available to each country, but how countries will finally administer that vaccine among their vulnerable groups, among the health workers, among the elderly, is every country's own choice. So with that, I thank you once again, and can I now invite Dr. Harshvardhan, Honorable Union Minister for Health and Family Welfare, Science and Technology, Earth Sciences, to please make his intervention.
Thank you, Dr. Poonam Khetwalji, our RD for the region, all the distinguished officials at the WHO regional office in this meeting right now, all my colleague health ministers of the region and their health officials, all the countries. Thank you, Dr. Poonam, for giving us this opportunity of presenting before the regional colleagues the challenges that we faced during the last 6 months, and more particularly about the treatment that we gave to the non-COVID facilities also. Before I say, I would also like to join you in congratulating and conveying my best wishes to the Health Minister of Indonesia on his birthday today, and also my good wishes to all our colleague ministers and our friends in WHO. Well, you will all appreciate that in India we are into the 7th month of the pandemic, yes, and of course in the world it's almost the 8th month we have already entered since our last case we had on 30th of January, and in a country as vast as 1.35 billion population, it's very difficult to describe these challenges within a couple of minutes, but still I will run through a few slides so that the colleagues in the region can have a fair idea of what we could do, how we are progressing well, and what are the challenges that we still continue to have. So I start with this first slide. Can you go to the next slide, please? So this is the slide which in fact shows that on the 7th of March, China had identified this new type of coronavirus as a causative agent for the pneumonia-like cases. And you can appreciate in this slide that India recognized the need for a prompt response to the situation and initiated with the first joint monitoring group meeting on 8th of March to monitor the situation. Next slide. This slide in fact shows that India's response was based on the past learnings of the various outbreaks and the epidemic situations, and the experience that we gained in these various disease outbreaks during the last 2 decades, particularly in terms of our containment strategies. The whole of government approach was built on to respond to COVID-19 pandemic also, like we had done in the past. Next slide. This is the journey that we have shown in brief, which shows that we had a graded response with the evolving situation. India has had a graded response from the start and issued advisories and restrictions even before the first case was reported on 30th of January. We started doing all this on 17th January. The response in terms of strategies and action plans were escalated based on the extent of the spread and severity of the cases in the country. On 6th of March, you can say, although we started our screening at 4 airports on the 18th January itself, but on 6th of March, screening of all passengers started and all incoming flights were banned by 22nd March. The first partial lockdown, Janata curfew, was implemented on 22nd March, and the world's biggest, most severe lockdown was put on 25th March. The lockdown is being lifted in a staggered manner starting 1st June, yet maintaining essential social distancing measures and restrictions on mass gatherings. Can we go to the next slide? I think the previous one. This shows that we had a proactive response and started screening of travelers before cases were reported, and a complete lockdown at a total of 657 cases. We started screening at our borders, 12 major and 65 non-major seaports and integrated checkposts at all international airports. Next. This again shows that we have had a multi-level institutional response with a whole of government approach led by our Honorable Prime Minister. Various ministerial groups, expert committees and task forces have been formed that are consistently monitoring and reviewing the situation, developing strategies, guiding and providing hand-holding support for the on-field implementation of the action plan. You can see in this slide that the group of ministers headed by me, we held 19 meetings till now. Then the committee of secretaries headed by the cabinet secretary held 51 meetings, and similarly 37 meetings of the joint monitoring group, and at every level, even at the level of the health ministry headed by the health secretary, there were 58 review meetings till now. So it's a detailed response at every level, monitoring at the highest level. Next slide. This is again showing that there was a simultaneous focus on every aspect of handling the pandemic, improving our core capacities and giving attention to all aspects, mainly focusing on surveillance, testing, containment and clinical management of the cases. Can we go to the next slide? This slide shows on the left side, you will be able to appreciate India vis-a-vis other most affected countries has a very high population density and less support in terms of GDP expenditure on healthcare, beds and doctors availability. And on the right, extreme right, you can see, yet we have been able to control our population, standardized cases and deaths due to COVID well below other countries. It gives you a comparison of cases per million and deaths per million. This is another slide which shows that how the lockdown helped us. The early lockdown enabled the country in many ways. While the growth rate during the initial phases was as high as 36% before the lockdown, it came down drastically and has been consistently decreasing even after the lifting of the lockdown. Next slide. Then this is how we built up our infrastructure during the course of the lockdown. The other gains of the lockdown were the utilization of that time period to quickly augment our healthcare infrastructure to support the growing number of cases. We have been able to increase our isolation beds more than 34 times and ICU beds more than 20 times. And then right now on evaluation we find that the daily handling capacity of COVID cases in our hospitals has increased to almost 35 times. Can we go to the next slide? This slide gives you, because WHO in fact all the time was saying test and test. And we remember the time in the first week of March when we were doing just about 6,000 tests a day. So we have been focusing on testing to detect cases as early as possible and have done more than 20 million tests as of today. The testing capacity has been augmented to a total of 1,366 laboratories, which are conducting more than 600,000 COVID tests daily in the country right now. And it would be pertinent to mention that we have started our journey from one lab in the country, and right now we are at 1,366 laboratories all across the country. And in a country as vast as India, within 3 hours, a person can reach a lab, 3 hours travel time anywhere in the country. Then the next slide is, it shows that 33 states and UTs in the country, they exceed the WHO norm of 140 tests per million per day and have been continuously increasing their capacity. So it's except for 3 states and union territories, 33 out of 36 are already doing better than the prescribed norms by WHO on the testing front. Then the next slide shows that our focus has been on community surveillance and containment, and we had started all this right from 17 January itself. Our efforts in containing the spread have been around aggressive, continuous community surveillance and management of COVID cases within the containment zones. Next. This slide shows that even now our active cases are still concentrated in a few states only, and as a result of an aggressive containment strategy, though we have the third highest absolute number of cases, our cases are still concentrated in only these few states and districts. Then this is a slide which shows that how we in fact mapped our patients to various care centers. We identified a 3-tiered dedicated COVID facilities system for clinical management of the cases with both the government and the private sector participation. For the milder cases, COVID care facilities that are usually makeshift arrangements made in hostels, hotels, schools and stadiums. For moderate and severe cases, COVID care health centers and hospitals with ICU and other life support systems in place. So this worked very well and is helping us a lot in handling the COVID situation. Then the next slide. This slide shows that within 10 to 12 days we were able to create these big facilities with the support of our DRDO, and these are the facilities where from 1,000 to almost 10,000 beds have been created, and they are working quite well right now. Next slide is about, this slide shows how we have been able to handhold support to health facilities for effective case management. In terms of capacity building needs, state, district and facility level trainings have been undertaken for healthcare personnel on ventilator management, clinical protocols and infection prevention and management areas. Then Center of Excellence initiative is undertaken where our premier institution aims New Delhi is supporting all healthcare facilities all over the country for better case management for COVID cases. Then also you can see that in contrast to the international data, the patients requiring ventilator support and the ICU support and the oxygen support has been much below 5%. Next. Then this slide shows that overall the strategy for treatment has been to detect the cases early and provide a seamless hospitalization experience, emphasizing on saving lives and ensuring the availability of both COVID and non-COVID healthcare services to the people. Sorry. Now this is another slide which shows that how the number of active cases have gradually reduced and the number of recovered cases have been gradually improving. Given our doctors and other paramedical teams, their tireless work on the field, there has been a continuous decrease in the share of active cases and a rise in the recovery cases. You can see that right now the recovered cases are almost double the number of active cases. This is, I think, because of the concerted efforts on the field, which has translated into these higher recovery rates. Every day the recovery rate is much better than the earlier day. Next slide. This again shows that the effective clinical management which continuously led to the decrease in the fatality rate. It has been very heartening that our fatality rate is probably the lowest in the whole world, and the recovery rate also probably the best in the world. And you can see continuously the fatality rate going down. The next slide, this slide shows that India has leveraged technology to fulfill the healthcare needs arising in the pandemic situation, ranging them providing online OPD services in lieu of the restricted movement of people, providing an online platform for training for the healthcare staff, also prediction of emerging hotspots with Arogya Setu applications, Itihas data. Arogya Setu, as you know, is probably one app which has attracted the maximum number of people, not in India, but I think anywhere in the world there is no such app which got so much of 12 to 13 crore people on the Arogya Setu app right now. Then this slide shows that with an unprecedented demand on healthcare system and an adversely impacted healthcare seeking behavior influenced by misconceptions, there was an increased need to maintain people's sense of trust in the system and to minimize the morbidities and mortalities from other non-COVID conditions. And here we can see that the healthcare system has had a synchronized focus on strategizing the COVID-19 related activities along with a continuous provision of non-COVID essential services. We never lost our focus on the management of these non-COVID patients. Then this next slide shows that the strategy and the preparedness of states for ensuring the essential non-COVID services in areas such as reproductive, maternal, newborn, child and adolescent health, communicable diseases and chronic illnesses is reviewed periodically at the highest level. It was reviewed regularly by the health minister, by the health secretary, continuously, and everything relevant was mentioned to them. And later on, in fact, we posed this issue over them and wanted them to report back with detailed presentations what is being done on this. So this was monitoring at the highest level, at the central level as well as at the states level. Next. This slide again describes the strategy for the delivery of the essential services. Briefly, it is about realizing that our hospitals are dealing with the highly infectious diseases. The hospitals have been identified and clearly communicated. All the suspected and confirmed COVID cases get treated at these dedicated COVID facilities. People seeking non-COVID services or those who are unsure of their needs are treated at our healthcare centers or are teleconsulted, and then, though clearly demarcated, both these facilities are a part of an integral approach and work in tandem to provide seamless healthcare services to the population. So this gives you a fair idea of how we work. Then we regularly provided guidance to our federal units, provided them continuous support in terms of guidelines, reviews and hand-holding, field support, which was being provided to the state both virtually and by teams which were visiting the states periodically and depending upon the need relevant states. A few focus areas besides COVID have been these reproductive, maternal, newborn, child and adolescent health, vector-borne diseases, immunization services, leprosy, tuberculosis and other interventions such as blood transfusion services and safe use of protective equipments. Can we go to the next slide? Yes. We all know that this was an area which required a lot of attention during these COVID times, and realizing the psychological impact of the pandemic situation, the focus on mental health has been central to our strategy. A comprehensive approach ranging from helplines to communication materials has been undertaken to ensure mental well-being of the population. Can we go to the next slide? This slide, in fact, shows that we promoted the best practices of various states to other states, encouraged them, motivated them, publicized the best practices of the various states and shared them with the rest of the country. And this was quite a bit of success. They were utilized by others, the experience of the various states, and we created a decentralized healthcare structure and customized action plans for each state. We provided great learning opportunities across the states that we acknowledged and captured centrally for a wider distribution and replication. So this is just to summarize that India has prioritized the availability of essential health services while simultaneously managing the COVID-19 pandemic. We are fairly satisfied with the progress that we have made during the course of the last 6 to 7 months, and we hope that with continuous support and guidance from the World Health Organization, we should be able to do much better in the coming weeks, and hope to mitigate COVID-19 situation in the near future. This is what we all wish and pray and trying our best for. On the vaccine front, I would like to add that at least at 3 places we are in a situation where the vaccine candidates are in the clinical trial stages in various phases, phase 1, 2 and even in phase 3, and we hope to contribute to the development of the vaccine initiative jointly launched by the whole world in collaboration and guidance of World Health Organization, and we are quite hopeful that India should be able to contribute significantly on the vaccine development front also. in the near future times, and also then later on we having a big manufacturing capacity and capability. We are already having the potential to provide 60% of the vaccine manufacturing abilities of the whole world. So we are hopeful that India should be able to play a very significant role in helping the world in handling COVID through vaccines. So this is all about how we have been doing over the past 6 months in brief, and if there are any questions later on, we can answer them also. Once again, thanks RD Dr. Poonam Ketpal Singh and all the colleagues at WHO for giving India this opportunity. Thank you.
Thank you very much, Excellency, for
अगर घर में कुछ भी नहीं हो तो आज की रेसिपी है 5 मिनट में झटपट बनने वाला ये ब्रेकफास्ट या स्नैक। बहुत ही अच्छी रेसिपी है एंड वी आर हियर विद द लवली दुर्गा माँ फ्रॉम चेन्नई से है वो, और आपने उनकी पहले भी रेसिपीज देख रखी है पर ये बहुत ही शानदार रेसिपी है। आई पर्सनली लव दिस रेसिपी, दैट्स व्हाई वी आर डूइंग दिस लाइव वीडियो विद हर। आप सभी का स्वागत है जायका का तड़का में। सो आंटी, आज हम बना रहे हैं आटे का डोसा, राइट? आटे का instant आटे का डोसा and it's so yummy. Last time I ate almost 3 to 4 dosa here, so I'm really looking forward to this recipe. So aunty, start करें?
Sure.
So बताइए.
The ingredients are all here. 1 cup of atta, about 1/3 cup of this one
rice flour,
or just a tablespoon will also be enough of rice flour, 1 spoon of jeera, little kadhi patta, 1 mirchi cut into small pieces, hing powder, and 1 measure of this curd or buttermilk, whatever you have.
Okay. So batter,
if it's kata, good enough.
Okay.
Or even if it's not kata, also fine. So I'm going to